Hi, my name is Mel, and I chose to talk about the potential effects of non-steroidal anti-inflammatory drugs, or NSAIDs, which is a lot easier to say, so I'll stick with NSAIDs, on a fetus during pregnancy. So, NSAIDs are drugs that help reduce inflammation, but they're not steroids like prednisone or cortisone, for example. They work by limiting the production of enzymes that are needed in order to produce prostaglandins. And your body makes prostaglandins in response to being injured, which can then trigger pain, inflammation, swelling, maybe fever in order to start the repair process. Some prostaglandins are also involved in blood clotting and in uterine contractions during menstruation and labor, which is I thought was interesting. So most people will reach for NSAIDs when they're experiencing pain or fever. Some people take NSAIDs to manage longer term conditions such as autoinflammatory conditions as well. Uh, Often, if you've got something that's giving you a lot of pain and there's swelling involved, your doctor will recommend taking NSAIDs to reduce some of that inflammation. Some examples of NSAIDs over the counter. The most familiar examples are ibuprofen, that's the active ingredient in Advil and Motrin, naproxen, which is the active ingredient in Aleve, that topical medication diclofenac, which is in Voltaren cream or gel, and ASA or aspirin. Those are the over the counter available versions of NSAIDs, and they're sometimes included in combination medications. So it's important that pregnant people understand the risks and read the labels on any medications that they're planning to take. Other NSAIDs available by prescription include things like Selexicab, Toradol, Indocin, and Naflon. Now, acetaminophen, which is the ingredient in Tylenol, works in a similar way, but it's not considered an NSAID because it mostly works in the brain, blocking pain without having much effect on inflammation in the body. This is usually the alternative medication recommended for managing pain and or fever during pregnancy. So, taking NSAIDs are associated with different effects at different stages of gestation. NSAIDs in general, aside from aspirin, taken in any period, might increase the risk of miscarriage. In the first trimester, NSAID use may be associated with a slightly increased risk of congenital heart defects, in particular, a type of heart defect called a cardiac septal defect, which is like holes between the chambers of the heart that don't close up properly, as well as craniofacial deformities like cleft palate. In the second trimester, again, aside from the increased risk of miscarriage, recent evidence shows that taking NSAIDs between the 20th and 30th weeks can have an impact on the fetus's kidney function, which can result in low levels of amniotic fluid and may cause miscarriage or preterm birth. In the third trimester, using NSAIDs can cause the ductus arteriosus to close too soon. So that's a blood vessel that kind of bypasses the lungs part of the circulatory system, because in the uterus, the fetus isn't getting oxygen from breathing, it's getting oxygen from the umbilical cord. Usually that uh, Usually that ductus arteriosus closes within the hours or days following birth, as the baby is getting oxygen by breathing air through the lungs. When this closes before the baby is born, it can cause damage to the right hand side of the heart, it can cause congestive heart failure, and it can cause fetal death. Very serious. It's a fairly rare but extremely serious effect. And so it's recommended to avoid taking NSAIDs in the third trimester at all. Even if the ductus arteriosus is not affected, NSAID use in the third trimester can still lead to kidney function impairment in the fetus, which again leads to low amniotic fluid levels and increases the risk of miscarriage or preterm birth. So the best way to avoid the risk of harm to the fetus is to avoid taking NSAIDs during pregnancy at all, with the exception of low dose aspirin if a doctor feels like it's warranted, like if the mother is at higher risk for stroke. Instead, it's best to use non-medicinal remedies for pain wherever possible, like, taking, if the pain's coming from tense muscles, taking a warm shower, getting a massage, that kind of thing. If medication is necessary, to use Tylenol. If a doctor determines it's absolutely necessary to use NSAIDs during weeks 20 to 30, it should be at the lowest effective dose for the shortest duration possible. And if that treatment has to be longer than 48 hours in duration, Health Canada recommends ultrasound monitoring of amniotic fluid levels so that if something is going a little wonky there, they can counsel the parent and make decisions appropriately. After week 30, NSAID use should be avoided completely. Again, because of that significant, like the slim chance of significant effects, including possible death of the fetus. Now, it's important, though, to note, all of that said, having an untreated fever is more strongly associated with birth defects and other adverse effects than NSAIDs are. So if a pregnant person has a fever and is unable to take Tylenol due to, say, an allergy or an intolerance, the risks of using NSAIDs to treat the fever may be less than the risk of not treating the fever at all. So if that's the case, the pregnant person should definitely contact their doctor or OBGYN for advice to figure out what the best course of action for them and their unborn baby could be. In order to find out more information about which medications are safe to use during pregnancy, people can contact their medical practitioners, including their pharmacists. Pharmacists are a really great resource, especially if you want to ask if an over-the-counter medication is safe to use or if it interacts with medications you're already taking. Sometimes we forget that's a great place to go for advice. Also, people can call 811 in Alberta as well. Yes. And here are my references. They're pretty crammed in there and hard to read, so I'll make sure and put them into a comment on my discussion post. Thank you very much for your time and your attention, and I look forward to your questions.